If you go into the office already a bit nervous and you come out not feeling a whole lot better, then that's a red flag that you shouldn't just give up to your insurance card and say, well, I'm stuck here because I have to be stuck here.
Mm-hmm.
Plan ahead for this event because you will remember the birth of your children every day for the rest of your life. You will. And you want to have good memories. I mean, everybody loves their kids, but I've talked to so many women, and again, all you have to do is go on social media posts and stuff like that about women who are traumatized by the birth of their baby. Why should we have that?
Welcome to the Rewire for Birth podcast. I'm your host, Dr. Cindy. I'm a naturopathic doctor and birth guardian, and I couldn't be more thrilled to have you here. This podcast is all about rewiring the way we think about pregnancy, birth, and postpartum by offering a holistic perspective that empowers you to embrace your journey with confidence and strength. Each week, I'll bring you expert insights, valuable advice, and inspiring stories to help you feel prepared and empowered. We'll dive deep into the transformative experience of bringing new life into the world and explore ways to make your birthing journey truly beautiful.
Please remember that although Cindy is a naturopathic doctor, she is not your naturopathic doctor. This information is made available to you for educational and informational purposes only and should never be used as a substitute for medical advice. Please see rewireforbirth.com/disclaimer for details.
On this episode of the podcast, we have Dr. Stuart James Fischbein. If you haven't heard of him, he is a community-based obstetrician and an associate of the American College of Obstetrics and Gynecology. He's also a published author of the book Fearless Pregnancy, Wisdom and Reassurance from a Doctor, a Midwife, and a Mom, as well as several peer-reviewed papers, including Home Birth with an Obstetrician, Breech Birth at Home, as well as twin home births, outcomes of 100 sets of twins in the care of a single practitioner. After completing his residency at Cedars-Sinai Medical Center in Los Angeles, California, Dr. Stu, as he is known, spent 24 years assisting women with hospital birthing and for the next 12 plus years was a home birth obstetrician who worked directly with midwives assisting local Southern California families. Since retiring from attending home births in late 2022, Dr. Stu has turned his focus to traveling around the world as a lecturer and advocate for reteaching breech and twin birth skills. I cannot believe that these skills are not even taught to many practitioners, as well as teaching respect for the normalcy of birth and honoring informed consent. He hosts the weekly Birthing Instincts podcast with co-host Bliss Young, and together they offer hope, reassurance, and safe, honest, evidence-supported choices for those women who understand pregnancy is a normal bodily function, not to be feared. Please go ahead and follow him on Instagram at Birthing Instincts. And you can also reach him at his website, www.birthinginstincts.com, as well as birthinginstinctspodcast.com. I'm going to list that all up in the show notes. And without further ado, I'm so excited for this episode. We've had to break it into more than one episode because we just could not stop chatting about these important topics. Let's dive in.
These companies are sponsored in huge part by Big Pharma. I know the American College of OBGYN took millions of dollars from the HHS and from pharma to support the COVID vaccine in pregnancy. And we know from exposés that the most pediatricians, if they're in a insurance situation or whatever, that they get paid a bonus for having a certain percentage of their children in their practice vaccinated. And that is the classic conflict of interest. If it's good for the kids, why are you paying a bonus for that?
Mm-hmm.
Why are you using coercive techniques like putting out statements saying that you can't go to school without this? What is that? I don't know that enough people see the news anymore because I don't think anybody's watching the news. So I think people are getting their news from X and from Instagram and TikTok. And I'm not really confident that those are good sources of news either.
Especially with
So,
AI now.
especially with AI now, you have no idea what's real anymore. That's why I tend to rely again on people who have a good reputation and haven't got caught lying in the past, and often write on Substack. There are really good writers there that I trust. I could name a few: Naomi Wolf, Barry Weiss, Matt Taibbi, Cheryl Atkinson, Alex Berenson. These people, other than their own popularity and clicks, they have very little to gain from being counter to the narrative of what the big pharma and big medicine is telling people. So I think it's a bolder stance than somebody who comes out and basically is a sycophant for big pharma. When they say something, it's hard for me to believe anything that they say anymore.
Mm-hmm.
Because they've been proven wrong over and over and over again. Whether or not they're wrong on this individual issue, they have no credibility anymore. And that's really sad, because I went into medicine partly because I didn't know what else to do with myself. I was a science major, son of a Jewish mother, so I chose to go to become a doctor. I went into it with the idea that of doing good, of wanting to help people, taking an oath, and in the image of the doctors of my day when I was young was Marcus Welby and Dr. Kildare and Ben Casey, and these shows where the docs were all-knowing and they were friends of the neighborhood and they solved problems and they were heroic. So there's a little bit of that. Most doctors have an ego, and they deserve to have some, because getting through pre-med and medical school and residency is not an easy task. But somewhere along the line, they sort of lose their way because nobody went in there to do bad. Nobody went in there to do evil. And yet many doctors are doing bad things. And either they have to know about it, which is unthinkable, or they're buried their head in the sand, and that's not a good testimony to them either. So why don't they all know what you and I are talking about? And they don't want to know. It has to be a cognitive dissonance because it's too uncomfortable after 20 years of doing something to realize that I have been doing something that's wrong. For years, I took babies to the warmer right after. We clamped the cord as fast as possible. Never did delayed cord clamping. Immediately the baby was out, we clamp the cord, show the baby to the mom, and walk it over. I deprived many of those babies from their stem cells, their cord blood, their communication with hormones with mom for 20 minutes, an hour, along the cord pulsates, for the skin to skin, for the bonding, for the immediate latching. I deprived those kids of that. They got wiped off. They got wrapped up like a burrito. Some of them got shots right there before they even got to mom. They had goop in their eyes. I didn't know any better. I only knew what I was trained to do. But there's enough information out there now that if doctors just look up for a second, they could find that maybe what they're doing is wrong. It gets back to the whole idea that they're employees. So even if they look up and they see they're doing something wrong, I can't fix it anyway because my employer won't let me, which is sort of a cop-out, by the way. You should change your employer. You should change your employee, or you should run for medical director of your company and make changes. That's what you should do. Shouldn't just duck your head down and go along with a company or an organization that has a 40 or 50% C-section rate. You have to be out of your mind to continue to do that.
Mm-hmm.
It's not good.
You'd be
It's
forced
not good
to
for your
face.
soul.
Yeah, you'd be forced to face this big decision then if you looked up, and that's not
Right.
easy.
Slightly more and more people are doing it. Like you said, it's going to take a long time
Mm-hmm.
because the system is feeding itself. It is the blob that ate Cleveland. It's just getting bigger and bigger. And there's a lot of money in it. It's like the military industrial complex. It's like war.
Mm-hmm.
Who wants war? Nobody really wants war. But there is a big force out there that wants war. As long as it's not in their neighborhood,
Mm-hmm.
they're fine with it because they make a lot of money on it. Whether it be machinery or arms dealing or whatever, it's a huge industry and it's evil. And yet it goes on.
Mm-hmm.
Financial markets are the same, the insider trading and all that other stuff that goes on. Good people get sucked into it because money is the absolute corrupter. And as you said at the very beginning, it's hard to fathom that good people will sell their soul for $1. Well, maybe not $1, but they'll sell their soul for a certain price. Everything's for sale, as they in the movies, right?
Yeah. And it's so disheartening to think that can impact this very sacred moment in someone's life to make that connection. But it does. And there are many factors that we've listed that leads to this. I want to circle back to a few things. I'd love to talk to you about baby aspirin in pregnancy.
Okay.
And see what your take on that is.
I did a Patreon segment on that, and
Okay.
there are doctors who think that baby aspirin is like snake oil. It cures what ails you, and we're going to put everybody on baby aspirin. But again, that is assuming that aspirin has no downside.
Mm-hmm.
Does it have a downside? I don't know, because nobody's really studied to see what might be caused by aspirin long term in moms and babies that get aspirin their entire pregnancy. So we don't know. Probably has a very minimal risk to taking it. It does affect platelet aggregation and ability of platelets to clot. If you do take it, you want to stop it by 36 weeks. But I don't think that anybody is going to bleed to death because they've been on aspirin. But we don't know what else it's doing because it does other things in the body, and it crosses the placenta, and babies forming enzymes and doing things. And is the aspirin messing with that? Who knows? Because no one's tested. What they've done is they've looked at aspirin in different situations to decide whether or not it will prolong a pregnancy or prevent a problem. And there are a couple of episodes of things where the data does show that. But again, I think the data is pretty good, but I'm not an expert at interpreting data to know whether or not it means anything. But the only place that it seems like it has good evidence of benefit is a woman with a previous history of gestational hypertension or preeclampsia, or preventing a recurrence of that in a subsequent pregnancy. But it doesn't prevent it 100%. It lowers the rate of recurrence. That has been shown to be proven. But to use it because a woman's over 35, or to use it because a woman has twins, or to use it because of something else, there's no good science that suggests that there's a reason to do that. And yet it will still be done. Women that have repetitive miscarriages are automatically put on aspirin, and sometimes on a blood thinner called Lovenox. Sometimes they'll have blood tests that show that there's some sort of thrombotic issue with their body, and so that may make sense. But to do it in general, just because a woman's had a miscarriage, there's no data to support that. So doctors that prescribe aspirin are sort of grasping at straws, which a lot of us do when a woman is having a problem with keeping a pregnancy or something like that. Why not? And that may be true, but I'm just saying that the evidence isn't there to support using it universally.
Mm-hmm.
So that's what I would say about aspirin. If you've had a previous episodes of preeclampsia or gestational hypertension, then in a subsequent pregnancy, there is data to support that. But other than that, the data is sketchy at best.
Mm-hmm. And it has to be taken early on.
You have to take more than 100 milligrams. So baby aspirin in the United States has 81 milligrams in it. So you need to take 1.5 or 2, and you need to start it before 16 weeks, they said.
Mm-hmm.
If you start after 16 weeks, or you take less than that amount, they found no benefit from that. So putting somebody on one baby aspirin a day may sound like they're doing something, but again, the data doesn't support that that's beneficial or not.
Mm-hmm.
A lot of these things are done just as pacifiers,
Mm-hmm.
because you feel like a woman comes to you with a problem and you feel like you want to do something. And sometimes doing nothing is something, but doctors don't like doing nothing. And patients don't like it when doctors do nothing. Patients don't like when doctors say, don't worry, you'll get better, it'll be fine. There was a study that was done years and years ago, probably 3 decades ago now, where they looked at women with the flu, so the viral illness. And they did a study where they saw 2 doctors. One doctor saw them for 2 minutes and wrote them a prescription for an antibiotic, and the other doctor saw them for 20 minutes, give or take, and I'm paraphrasing it, of course, and explained to them why viruses don't respond to antibiotics and why they just need to go home, take vitamin C, rest, have some chicken soup, that sort of thing. And then they surveyed the patients afterwards and who was the better doctor. And the majority of patients said the doctor that wrote a prescription was a better doctor.
Wow.
Because patients come to the doctor wanting to be fixed.
Mm-hmm.
So sometimes we prescribe things like baby aspirin because it feels like we're doing something. But the data really isn't there to support it except in that one indication right now.
I see.
That's my opinion. Again, people will find that there are other people who have other opinions, but that is my opinion. And I tend to do deep dives into these things because we do these topics.
Yeah.
So I take the time to do them before we do a segment either on a podcast or on a Patreon segment. And we did one recently on aspirin and Patreon. Go to our Patreon page, which you can put in the links if you want.
Yeah, we definitely will, because I think it's very valuable, because it's a lot of things that are just routinely prescribed. Everyone I know who has an OB doesn't have a midwife will get put on baby aspirin.
I just want them to know that there's maybe no harm from that, but there's likely no benefit from that. So if there's no benefit other than a theoretical benefit with no safety testing,
Mm.
and women had babies for eons without taking aspirin prior to 2025, why would we suddenly think that giving aspirin is a miracle drug?
Right. I did hear, I believe her name is Sarah. Yeah, Sarah Thompson, say that it will most likely prevent preeclampsia in about like 12 to 13% of cases. So that leaves a
Yeah.
lot of people who are on it that won't benefit from it, right? But
It's a small decrease in the rate of recurrence. As far as giving it to prevent preeclampsia in someone with having their first pregnancy, again, I don't think the data is solid there. I think if anything, that would be a consensus opinion, but there's no good randomized trials that say that works.
mhm,
As far as I know, I skim the journals for articles that are interesting to me and I read those. And
mhm,
so I keep up on that. When I'm doing a topic, then I dive into it.
mhm. And when we're talking about the evidence and research and stats and all that stuff, I think it's interesting for anyone listening to know that, like, first of all, the pregnancy demographic is a little bit difficult to study. And so in previous decades, studies have actually been done on men and then applied to
That's
pregnant
true.
women, right? So we always want to say, oh, this study and like the science and all this stuff, but what are we actually talking about when we say that? So I just think that's interesting.
That's a really good point. Yeah.
Yeah.
Right. It's another sort of stage one thinking, which my profession is filled with. Just because it applies to men doesn't mean it applies to pregnant women or it's safe for fetuses.
Mhm.
We don't know. They have these human subjects issues where with the ethics of testing things on pregnant women. So they just extrapolate that it's probably safe and let's do it. But there's a
Mhm.
long history of them saying those things with drugs that were very, very detrimental, like thalidomide, like diethylstilbestrol, like cytotec in women with a previous cesarean section, causing increased uterine ruptures. These
Mhm.
things were just given without any sort of real testing to them, causing significant problems, all in the name of, well, it probably will work, so let's give it a shot. Right. Let's see what happens.
Let's give it a go. Why not?
We probably shouldn't do it.
Yeah.
Again, we create problems that aren't really problems and then we try to solve them. It's sort of a straw man science.
Mhm.
Was the outcomes of pregnancy so bad in 1970 that we needed to do all the things we've done since 1970? No.
Have
All the,
worse outcomes.
yes. And far more interventions
Mhm.
and far more costly obstetrical care.
Yeah.
We're spending far more money in inflation adjusted dollars than we should be spending, and we're doing worse or certainly not better. That is the definition of insanity.
Yeah.
Classic definition.
Yeah. Absolutely. I love zooming out and then zooming back in. So let's zoom back into a couple of routine things. The vitamin K shot right after birth. And I know you've done segments on this as well. But regardless of anything else, I was just looking at my daughter's foot the other day, and she still has the little prick spot where she was given the vitamin K shot. And I'm
Well,
just,
her foot was probably where they did the newborn screen.
oh,
The
yes,
vitamin
yes,
K,
true.
yeah, the vitamin K shot would go into the baby's thigh generally, which
Yes,
is
you're
bad
right.
enough. But the heel stick is for that newborn screen for those genetic things, right?
Right.
Or they might have done a glucose test on her heel too. I don't know what they did, but yeah, they
Yeah.
wouldn't give a vitamin K shot in the heel, just so you know.
Okay. Okay.
Yeah, I understand what you're saying. Let's talk about vitamin K for a second.
Okay.
All right. So, human fetuses or babies are born vitamin K deficient by our standards, right? But we're judging them by childhood or adult standards. their babies, their fetuses. Why would nature design a system for babies to be born vitamin K deficient if babies needed vitamin K? I mean, newborns. Why would they design a system like that? Nature isn't stupid. So maybe there's a reason that babies have low vitamin K when they're born. Don't know what it is. Maybe it's because vitamin K tends to make the blood a little more sludgier, and maybe blood needs to be waterier at that point to get all the developing capillaries in the brain and other body parts. And maybe nature designed a system that is perfect. So what is vitamin K deficiency bleeding? It's a horrible thing when it happens because babies will bleed either abdominally or intracranially. It can happen, but it's very rare. The incidence is about 6 per 100,000 births, which is about 1 in 16,000 if you break it down and change. So let's just say it's 1 in 16,000. So rather than assume that a vitamin K deficient baby is normal, for 15,999 babies, you can see where I'm going with this. We assume that it's abnormal, and so we give 16,000 babies vitamin K to potentially prevent one case of vitamin K deficiency bleeding without maybe wondering, what are we doing to the babies that didn't really need the vitamin K? What are we doing to them by giving them vitamin K and no one's looking? Because, Cindy, there is no money in not giving vitamin K. And there's a lot of money in giving every single newborn vitamin K. So we're judging babies by a standard that's designed for children or adults, which is you should have this much vitamin K in your blood system. But nature designed a system that says, no, we're going to design a system that baby doesn't have as much vitamin K and therefore doesn't have the vitamin K dependent clotting factors form until 6, 7, 8, 9 days of life, when the gut bacteria take over and start manufacturing this, and that's how it comes. But nature designed it that way. So maybe nature is smarter than we are. Maybe nature is a lousy obstetrician, and maybe nature knows that there's a reason for that. And yes, 1 out of every 16,000 babies is going to suffer something wrong. So let's figure out what's wrong with that 1 in 16,000 babies and treat them, as opposed to treating 16,000 babies, of which 15,999 don't necessarily need vitamin K. That is my feeling, because even though vitamin K is fairly innocuous, it does have adjuvants in it. It does have stuff in it that's going on. It doesn't have heavy metals in it, but it's got polysorbol, whatever. It's got things in it that you're giving to a newborn baby for something that 99.99% of babies don't need.
Mm-hmm.
So it's questionable to do that.
To at least think about it.
Yeah. And then they also have the oral option. The oral option is to give it more slowly, orally. The oral system, everything has to go through the gut, then through the liver. And if there are any things in there that you don't want the baby to have, to give it orally is far less damaging than to inject it and bypass your body's defense mechanisms, which is like your gut. So you could go with oral vitamin K if you think it's necessary. The definitive book on that, I think, is written by Sarah Wickham. I think she has a book out on vitamin K, and I think it's really worth reading.
Yeah.
Because she gets into the weeds on that.
Yeah, I think that's helpful. And we'll put that in the show notes as well. But it's an interesting perspective shift. And we came to the same conclusion when I was speaking to Kristen Nagel, because my question was going to be like oral versus injected. And she was like, well, why are babies even born with this specific level of vitamin K? Why are we looking at it like as if something's wrong with them?
Right.
Yeah.
Because you're assuming that nature did something flawed. But why would it do that? If nature thought that babies needed vitamin K when they were born, it would find a way to be able to transport vitamin K across the placenta. It would be able to do that. But for some reason, it doesn't do that. So again, the hubris of man to believe that we know better. Now, for those 1 in 16,000 babies, it's a horrible thing. But you can't prevent all bad outcomes. And that's the problem with the medicalized birth model, is they don't like nature's chaos. So they will always come up with some sort of treatment, which may cause all kinds of chaos, but they're not worried about that because it's the chaos that they're comfortable with, because it's iatrogenically created chaos.
Yes.
Yeah.
And that brings me to what you had touched upon as well earlier, is that so many of the issues and the reasons that for emergency C-sections is the interventions, is the induction, is the Pitocin, is the epidural, is laying on your back, is telling women they can't go to the bathroom and labor in the bathroom or go in the shower. All of these things, can't eat, can't drink. And so we're creating the issues that then we have to deal with, the downstream problems. I did want to touch upon, you did a study on breech and twin births.
Mm-hmm.
And if you can briefly summarize the outcomes, because it's pretty mind-blowing in the culture that we live in, just to hear some of the outcomes that you experienced.
Yeah, I collaborated with my friend Rixa Fries, who's the founded Breech Without Borders. Many of your listeners maybe know who they are. She's very wise, and she's an academic, and I'm not. So it's a really nice collaboration because we both brought our own expertise to these papers. We came out with one on breech, and we came out with one on twins. And again, our papers, because it's just me, they didn't have large enough numbers to, in most categories, reach any statistical significance. So they're observational papers only. So you can't really draw conclusions, but you can kind of get an idea of what's possible when you have a skilled practitioner, a willing client to do breech or twins in the out-of-hospital setting. And I'll just summarize. For the breeches, we had 60 breeches. And rather than compare our vaginal breech deliveries with cesarean for breech delivery, which is what every other breech paper does, I wanted to compare our vaginal breech deliveries to vaginal head-down deliveries, which makes much more sense.
Mm-hmm.
Because we're not saying that all women who have a head-down baby should be sectioned. But ultimately, if you did section all of them for the very first baby, you might save 2 babies. Okay. But what are you doing downstream, and what are you doing to all those babies themselves and the mother and all that other stuff? So no one in their right mind is suggesting we section all vertex babies, but they are suggesting we section all breech babies. So we would section 1,000 breech moms to save 1 baby, which makes no sense when you think about it. Clearly, if that's your baby, that makes sense, but we don't know who that baby's going to be. But what are we doing to the other 999 women who didn't need the C-section to save their baby? And what do babies do better when they're born vaginally versus by cesarean long term? And we know that there are downside risks to cesarean. You actually mentioned some of them earlier. So we had 60 breeches, that 10 were transferred for antepartum problems, preterm labor, preeclampsia, whatever. And those are all listed in the paper. And then we had 50 that went into labor. And of the 50, we had 40 that delivered safely at home. So 80% delivered at home. And then we had 10 that transferred to the hospital, and 2 of those delivered vaginally. So we ended up with 8 C-sections out of 50 women. So we had a 16% C-section rate. The C-section rate in multips was 0. The paper was heavily tipped toward primips, or first-time moms. Of the 50 that went into labor at home, 41 were first-time moms, and only 9 were multips. The 9 multips all delivered vaginally without a problem. So all the C-sections were in the primip group. So the success rate for primip breeches was like 76% at home, 80-some% overall, because we had 2 that ended up going to the hospital but had 2 good OBGYNs who were willing to let them continue to deliver breech at home. So what we showed was that with APGAR scores, perineal outcomes, these sorts of things, we found that vaginal delivery for twins, for breeches, was very successful at home with proper selection, which we go through the criteria, what makes a good choice for breech to birth at home, and a skilled practitioner. And we just showed that. And Rixa blew me away when she told me that our 60 babies in breech was the largest study of breech delivery at home ever published by a single practitioner, which is kind of a sad statement. Now, there are many midwives in the world who've done hundreds of breech deliveries, but they don't collate their data, and they certainly aren't publishing papers. And we're encouraging midwives now who are doing breech delivery to keep their data and maybe even submit it to Rixa or me, so that we can then collate that stuff. So someday we'll come out with something which is even a bigger paper that shows the benefits or risks of having breech delivery vaginally. And since it's not being offered in the hospital, I was doing it in the home setting. The twin paper was a little bit different. We had 100 sets of twins in my care over 11 and a half year period of time. So it's like 9 sets of twins a year. It's not a lot, but it's a lot for a single practitioner. And we, again, had great success with our multiparous moms. We had, I think, 46 out of 47 or 47 out of 40, 98.7% of our first multip moms delivered vaginally at home. And with our twin moms, we had, again, about an 80% success rate at home, and about 20% were sent to the hospital. There were 8 transports, of which 2 ended up delivering vaginally. We had 6 C-sections out of 69 women that went into labor. 31 of the women were transferred prior to labor for antepartum problems, which is more common in twins. So almost a third of our twins didn't make it to 35 weeks. But of those that made it to 35 weeks, we had a 91.3% success rate of delivery and 8.7% C-section rate, again, at home. And we had 35 breech babies. So we had 61 that delivered at home, so that'd be 122 babies. We had 35 breech babies, and we had a very high success, like 87% success rate in moms that had at least one breech baby, whether that was a breech first twin, a breech second twin, or both twins being breech.
Wow.
We did not see a significant difference in outcomes between monodi twins and di twins that made it to term. Once they made it to past 28, 30 weeks, we saw no difference in monodi and di twins. Yet, in the hospital setting, monodi twins are going to be treated much more scary and much more testing, and very likely told to be induced at 36 to 37 weeks. Again, sometimes before the babies are ready. We let our moms go as long as they wanted. We did start testing babies after 40 weeks or so, but our average gestational age was 39.0 weeks for our twins, which is longer than most practices will let any twin go. And our range was 35 to 42 weeks. So we had actually some twin moms that went to 42 weeks. People are going to say, you're crazy. Well, we aren't crazy, though, because the data does not support induction so strongly that it should be a blanket recommendation. When you look at the reason that doctors will induce twins is because they're worried about stillbirth. And so they'll say the rate of stillbirth rises. And they'll say that the relative risk is 4 times higher, 7 times higher, whatever. And that sounds horrible. If you go from 37 to 40 weeks, it goes up like 7-fold. But the truth is, it's still far less than 1%. So you need to give actual risk when you're giving counseling, not relative risk. Relative risk is deceptive. Some women would choose at 40 weeks to say, I don't want to go any further. I've had enough. I want to be delivered. Okay, fine. But other women will, given the numbers, will say, I think I want to wait. And so we let them wait. Because I learned from midwives that you really can have good trust and honor informed consent when you have a good relationship with the clients. And so I had a unique sort of practice that you don't see that much anymore, because doctors now are pretty much, like I said, employees working shifts in large groups, and they not necessarily have the same clients all the time. Whereas we did. We got to know them. I did my own ultrasounds. I got to know the twins. I got to kind of know where A and B like to lie, so that when I'm at the birth, I have this visual picture that's not strange to me. It's just a better system of practicing. You can't do volume, so it doesn't meet with the requirements of the medical model. And you can't do it for what insurance pays, so it might be inaccessible to many people because they can't afford it. That's why I said early on, I think that you should start saving for the birth of your children. Put it away, make an account that's solely for that. And by the way, if you're not having children, you'll have $50,000 in the bank. You can do whatever you want with it.
It's a win-win.
Right. But start saving early on in your life, a health savings account, and just put it away so that you have the choices that you might require, because 1 in 32 women have twins. So 3% of pregnancies are twins. Half of those twin pregnancies will have a breech baby in them. And a doctor who takes care of you for twins who doesn't know how to do breech is violating an ethical tenet, to be honest with you. To basically say, you have twins, half the time you're going to have a baby in there that I don't know what to do with, and so I'm going to do a C-section on you. And they should tell them when they find out they've got twins at 10 weeks. But they don't.
Yeah.
because you need breech skills to be a good twin caregiver. And since they're not teaching breech skills to obstetricians anymore, twins are not really in the purview of obstetricians anymore. Because who's going to take care of them? Well, midwives will. And do they do it worse? Well, they do it differently. They don't consider all twins to be high risk just because they're twins. High risk, by the way, Dr. Cindy, is not a number. High risk is something that makes the obstetrician or the medical community nervous. It isn't a number, and I can prove that without a doubt, because they will label something high risk like a VBAC, which has a 1 in 200 risk of the scar separating. These are general numbers, and about a 1 in 6 chance of any baby with a scar separation suffering a very serious injury. So the actual risk is about 1 in 6 times 1 in 200, or 1 in 1,200. They will label that high risk. So they'll offer that woman a repeat C-section. When I ask you if she wants a third or fourth or fifth baby, which carries more risk to that mother, having a VBAC or having a repeat C-section? Having a repeat C-section carries more risk to her, but the VBAC will be the one that's labeled high risk. If a woman's over 35, she's labeled high risk. So they'll suggest to her that her placenta might get old because she's old and that she should probably be induced at 39 weeks. Which has more risk? Being induced at 39 weeks because you're over 35, but which one's labeled high risk? Being over 35. The solution of inducing you is not labeled high risk, yet it carries more risk than if you just let the 35-year-old go into labor on her own. Especially if she wants more kids.
Yeah.
Same thing with breech. If you have a breech baby and you tell her she has to have a C-section and you don't ask her the follow-up question like, do you want more children? Which they don't ask. I have never asked a woman who came in for me for a consult from an OB in town that they referred to me by their doula, and I do a consult with them, and their OB is only offering them a C-section for their first baby because it's breech. And I asked the question, did your doctor ever ask you if you want more children? And the answer is always no. I don't mean this in a pejorative way, but that doctor only wants that live baby in the bassinet and doesn't really care what happens to that woman next time or the time after that. But if you section her for breech and she wants another baby or another second or a third baby or fourth baby, you've now introduced something that has higher risk than letting her deliver vaginally breech with a skilled practitioner. But they will label what they are uncomfortable with high risk, and they will offer a solution that carries more risk to it as the solution for what they consider high risk. It's crazy. If I had any hair, I'd pull it out, but it makes you nuts.
Yeah.
That they don't see it.
Absolutely.
Because their mission is different. Their mission is to survive the day, to get through the day without an adverse outcome. And they don't consider a complication from cesarean to be something that's an adverse outcome for them. A wound infection, hemorrhaging, requiring a transfusion, an extension of the incision, injury to the bladder, bowel obstruction later on, or a placenta accreta in a future pregnancy. Those are not things that are considered in the equation of, well, you have a breech baby and I don't know how to do breech and it's dangerous and the head will get stuck and we should do a C-section on you before your baby falls out vaginally.
Right.
And there are stories for women coming in where the butt is beginning to protrude from the labia and they will push the baby back up inside and do a C-section only to deliver the baby breech through a C-section scar instead of the vagina. And that is, their logic is, well, if the head gets stuck, I can cut a bigger hole. No, if you knew how to manage a breech baby, it's very unlikely that the head is going to get stuck because you have maneuvers that you know what you can do. And that's what we train. That's what Rick does with Breech Without Borders. That's what I do with Reteach Breech, is we go around the world and we train those interested, which is almost always, again, midwives, very few OBs. Sometimes we get family practice doctors more than OBs.
Wow.
OBs are just, they're stuck in their hamster wheel and they're caught between a rock and a hard place that even if they learn it, they're not going to be allowed to do it anyway.
Yeah, that's so
So
important.
why do they want to learn it? It takes a lot more time and energy and risk to do a vaginal breech birth, they believe, than it does to schedule a C-section at 7:30 in the morning on a Tuesday and be out of the OR by 8:20 and back in the office by 9 o'clock. That's the easy way to go.
Yeah.
And what happens to that baby, that mom and that mom's babies downstream? It doesn't really come into play. And it sounds harsh. And I'm going to repeat it and repeat it and repeat it because it's true.
It's the system that we are experiencing, that you're observing over and over again. I want to just touch upon the lens that we see Breech through. We very much see it through the lens of risk again, rather than as a variation of normal. And it's very much possible to deliver a Breech baby. But I think it's helpful to have a skilled practitioner, someone who's seen it before, someone who understands it, and someone who knows when, okay, maybe it's time that we transfer, right? Just
Yeah,
to know those few things.
having a mentor and a guide makes sense. I'm not against free birth. I understand why people choose free birth, especially if they've had a traumatic experience in the hospital or whatever, and they can't find anybody because they live in a state that's got ridiculously obtuse laws. I understand that. I think people can also have in their repertoire not just saving money for their birth, but also consider relocating if they have to for their birth.
Mm-hmm.
If there's somebody in Arizona that does breech or twin deliveries vaginally at home or whatever, and nobody in California can do it for you, then consider 36 weeks getting an Airbnb. Not again, not everybody can afford to do that.
Mm-hmm.
But if you plan ahead, it might be something that is valuable because how you birth your baby will, again, be that indelible memory that's with you your entire life.
Yeah, for sure. And one of the things that is not often talked about as one of the negative repercussions of cesarean is the bonding. And I want to say the intensity of bonding because mothers love their babies, of course, except their babies. But because of the hormonal cascade that is involved when you bring your baby onto your chest, it is so intense and it is meant to be intense for the survival of this baby so that the parents will put that energy and effort into this thing that is waking them up in the middle of the night and driving them insane. And that is sort of, again, taken away, deprived. You use the word deprived for those parents that are just told it's going to be a C-section. You don't have a choice.
Mm-hmm. Yeah, again, because we're kind of beating this horse, but it is nature's design is there for a reason. You have to believe that. It works really well in pretty much every other species. Nature, it can be cruel, it can be formidable, but to quote Interstellar, but it's not evil. It's design, it has a purpose, and to mess with that system as we are doing constantly, we need to wake up our practitioners to say, listen, the system that you're in really isn't working well, and that's being kind. Can you start to make changes from inside? And we as consumers need to make changes from the outside.
Hey mama, are you ready to transform your birthing experience? We're offering a free guided meditation to help you start rewiring your brain for an empowered birth. Imagine feeling calm and in control, embracing your inner strength, and making your birthing journey smoother and more joyful. Doesn't that sound amazing? It does, right? And it's possible for you. To get started, visit rewireforbirth.com/meditate and grab your free meditation now. Let's make your journey beautiful together.
We need to go to our obstetrician before we're even pregnant and ask them questions that might make them slightly uncomfortable. Like, why don't you do breech delivery? Why does your hospital have a 40% C-section rate? Do you really believe that 40% of women can't deliver as nature intended? I mean, the World Health Organization, which is an organization obviously I have very little respect for many reasons, but they do say that the C-section rate in Western countries should be between 10 and 15%. And knowing that it used to be 5%, I'll give them that. But let's just say it's 15%.
Mm-hmm.
And it's over 30% here in the United States right now. That means that half of all C-sections being done are unnecessary. There's about 1.2 million cesareans being done every year in the United States. It's the largest, or the most common surgery performed by far. And now we're saying that at least 600,000 women are having unnecessary major abdominal surgery every year. And that would be being kind because it's probably higher than that. But let's just say 600,000. And nobody's complaining. If there were 600,000 unnecessary knee surgeries, do you think the insurance companies would be upset about it? They're paying for knee surgery that's unnecessary. But here they're paying for a C-section, which the hospital makes 2.5 times as much money as a vaginal delivery, and they're paying that out without a peep. Why are they doing that? Because they have the power. The power is in the economics. They have the power to change the way they reimburse. They could reimburse twice as much for vaginal delivery and cut back what they pay for a C-section by 50%. And suddenly VBAC and breech and twins and stuff would be a reasonable choice.
Yeah.
But
It's
They don't.
flabbergasting.
But here's the scary thing about that, because here's where cognitive dissonance sets in, and I'm certain about this, is if there's 600,000 unnecessary C-sections being done every year in the United States, who's doing them? Because no doctor goes home at night after a busy day and says, honey, guess what? I did 2 unnecessary C-sections today. No. Every C-section a doctor does, he believes is necessary, yet half are unnecessary. How do you cope with that? You have to have cognitive dissonance. You have to say, the other guy's doing the unnecessary ones, or that hospital's doing them. But what's that hospital or that other guy saying? It's you and your hospital that's doing them. And nobody takes responsibility for the fact that 600,000 women in our country alone, not to mention in worldwide, where you have 70 and 80% C-section rates in South Africa and Brazil and Armenia, and 39% in England. That's crazy. England was supposed to have this great midwifery-based obstetrical care, and last year in 2023, they had 39% cesarean section rate. They had over 30% induction rate. And we're supposed to be the model for how we're supposed to practice.
Yeah.
So something has gone awry. It's horrible. It's funny, these people will believe the World Health Organization, or the medical cartel believes the WHO when it benefits them financially. When it doesn't benefit them financially, then guess what? They ignore them. Which is just like what ACOG guidelines are. They'll follow the ones they like, they'll ignore the ones they don't like.
Yeah.
These are the leaders in medicine. These are the people that are making the decisions that how women should give birth, and it's got to stop.
Yeah.
They really should have no place at the table. If we get a say in the current administration and they start to work on maternity care, I was at a roundtable last month where we had people talking about birth and about fertility issues and things like that. And it was coming up as an issue as to why we have all these problems. We have falling fertility rates, falling sperm counts, rising C-section rates, as you said, rising dissatisfaction with it, rising chronic illnesses in our children. And this is what the medical cartel has given us. These people should have no seat at the table in the solution. They've skewed the term and they failed miserably, in my opinion. And their time should be done. And it should be turned over to a new way of thinking. And the medical schools and residency programs need to be revamped. Again, do I think this is going to happen overnight? No. In my lifetime? Maybe, maybe not.
15, 20
but it
years.
has to, because we can't keep going down this path. And the women of our country have to stop it. They have to be at the forefront of this. No politician, no hospital wants a bunch of pregnant women on their front steps with posters protesting. It doesn't look good. I'm not saying that we should do that, but the truth is most pregnant women, especially after you've had a baby, you don't have time for that sort of stuff. And that's what they take advantage of, is we are like herding cats. We're scattered all over the place, and we've got other things going on in our lives that we don't have the time to go lobby Washington or Sacramento or Austin or any other place, any other capital where there's big lobbies for big medicine. The American Medical Association has lobbies. The pharmaceutical companies have lobbies. The hospitals have lobbies. Consumers don't have lobbies. They do. They're like minuscule compared to it. And that's how these rules are made. We've got to be very careful if we want to ensure a better health for our future children and generations. And I think that everybody listening wants that. And so if we continue down the path, we're not going to get that. You have to change the way you're doing it. And would we have worse outcomes if 80% of women suddenly left the hospital system? And I would guarantee you that the answer is no. But we would lose hospitals. They would close and they would shut down, as we talked about earlier, because they can't keep their doors open because of the way the financial system is rewarding them. Yeah. So that takes greater minds than mine, or yours probably, to solve this issue, because I don't understand policy or business in that way. But something needs to be done. And hopefully they'll listen that can make these decisions and try to figure out a way that we can improve our healthcare.
Yeah. And in the meantime, if you're pregnant right now and you're faced with certain decisions, at least we've talked about questions you can ask your OB. And you've made the true statement of you have a better chance of having the birth that you desire out of the hospital system than inside the hospital system. And just surround yourself with people who are going to support your decisions. Get a doula, invest in this experience that you will remember for the rest of your life.
Yep.
It's okay to get the support that you need when you need it and not have to regret the decisions in 10 to 15, 20 years.
And check out your institutions. If you want a hospital birth, you don't have to wait till you're pregnant to check it out.
True.
Go over there, have a meeting with somebody on the board of directors. Ask these questions.
Yeah.
Become civically involved in trying to improve it. Your hospital is there supposedly to serve the community. Clearly, it's really there for its own financial benefit, which also serves the community. I mean, the two aren't mutually exclusive. But ultimately, if it comes down to it, they're going to choose financial viability over necessarily serving the community in the best way possible. So get a voice, get active, make a difference in your community, get on the board of directors, talk to your local nurses that work in the hospital and ask them what are things like there. Let's see what it's like. Talk to the doulas that go there. They do this ahead of time, plan it out. Because as you can make this a great experience, and you can trust that your body knows exactly what to do. And you can trust that a midwife or a good OB is going to sit back and let you do your thing and only step in when they sense something wrong and not constantly throw things at you to put you in a state of fear to manipulate you. Whether you're 25 or 35 or 45, if you're pregnant, the likelihood is you're going to have a normal birth. So that should be the default position, not that pregnancy itself is a high-risk condition and you have a medical problem. But that's the approach that doctors are trained in, and they can't get out of it yet. They don't know. It took me a long time to change. I always carry with me, whenever I used to go to a birth, always a little bit of a sense of anxiety. Always. Whether it was in the hospital or at home, didn't matter. Because some of that can be healthy. Having a healthy respect for the process makes sense. Fearing it and overcompensating doesn't make sense. It doesn't serve anybody.
Yeah.
And to have a woman spending her entire 9 months being nervous or anxious, we don't even think about what is that doing to the epigenetics of the developing fetus. Not to mention the difficulty she's having with getting through this time, feeling scared all the time and nervous. So
Absolutely.
maybe part of the problem with our society right now is because we've had 100 years of medicalized birth. It might very well be that a lot of our health problems, even though we can blame it on toxins in vaccines or toxins in our environment or the food we eat or the air or the 5G, we can blame it on other stuff. But just maybe our immune system begins in the womb. It begins before you're even pregnant. The mom needs to be healthy, but it begins in the womb. It is propagated more so when you come out and you're exposed to the proper bacteria and you get the microbiome and all that. And we've altered that. We've altered that with our interventions. We've altered that with the overuse of antibiotics. We've changed our own environment. Women who take an antibiotic for a bacterial infection often will get a yeast infection, and then their chemistries are out of whack, and then the yeast infection needs to be treated, and then they get a bacterial vaginosis infection because they changed the pH of their vagina, and they're chasing their tail because they took antibiotics for a cold that probably was just a cold and probably didn't need antibiotics in the first place, but they liked the doctor that gave them the 2 minutes and gave them the prescription for the antibiotic. And it all comes around. The whole dialogue comes back to these sort of things. We need to change that.
I agree 100%. It's so multifactorial from all sides. And that's a perfect segue into my last question. I really feel it's like it's validated over and over again. The more I speak to people in this community, there is such a profound imprint that takes place when a new life is entering this reality. And the imprint, as nature designed it, should be one of love and safety and trust, this big welcome party to this new life that is coming into this world. And those are all signatures of oxytocin. Oftentimes, based on the many factors that we've described, that imprint is one of mistrust. It is one of survival mode. It is one of uncertainty. It is one of fear. And that's okay. It's not permanent. We can do many things to repair that. But then this new life is moving through the world from that lens of fear and mistrust and unsafety and survival mode. And on a massive scale, almost 50% of women are experiencing trauma in their birth. That's perpetuating this problem on a world scale. And I think we'd be looking at a very different world if the imprint was one of love and safety and trust. So that's kind of my preamble, just to ask you, what would you like to imprint onto the ears of the listeners? It's a lot of women preparing for birth. It's a lot of women with new babies at home. It's also a lot of women who want to birth something beautiful into the world, use that creative life force, sacral womb space energy to birth a business or a creative endeavor. What would you like to imprint onto their ears, Dr. Stu?
I think that they should trust their intuition. I think we've gotten away from a mother's intuition. There's a saying about a mother's intuition. And when a mother tells me something, I find that most of the time they're on it, even before I or somebody else can pick up on it. And they don't feel something's right, they're usually right. When they feel everything's okay, despite being told that something's wrong, they're usually right in that as well. So they need to gain the power back by trusting their own intuition. I hate to say this, but you cannot trust the medical system. It's scary that I have to say that, but you can't. So I truly believe that the medical system is miraculous for certain things. You break your leg, you need your bones pinned, they're great at that. You have a retinal detachment and they can fix that, except not in my case, but most of the time they can, where otherwise you go blind. They can do miraculous things. You have twin transfusion syndrome and you can go in and you can laser the vessels that are communicating and you can make a survival of both twins when 50 years ago, 30 years ago, both twins would have been lost. These are miracles. But for the most part, what doctors are telling you is incorrect. I'm very strong about that because, again, I'm seeing a skewed population. I get people that write to me and tell me stories every day in my inbox of what we label dumb doctor dogma, which is a kind way of saying that they're being told stuff that makes no sense. That you have lowish fluid, that your baby's too big, your baby's too small, you're too short, your husband's too tall, you're too fat, you're too thin, you're too old, you're too young. All these things, what do they mean? How do I feel? I feel great. Or I don't feel so great. I'm pregnant, but I'm throwing up. But I'm feeling like everything is going fine. Trust that your intuition and take control of your birth. More if you have a ruptured appendix, you go to the ER and you're at the mercy of these doctors because you need the surgery or whatever. But take control of it. And when you do so, if you end up in the hospital, if you end up with a cesarean, you're not going to feel traumatized about it. You're not going to feel like you were duped, that you were coerced into something. You're not going to have regret next year or 5 years from now when you read something about this and say, God, that's what happened to me. And now that I think about it, maybe I really didn't need that C-section. I get this all the time. If you're in control from the beginning and planning ahead, that will help you have the best experience possible. So that's what I would say. And I think you can do that better in the midwifery model of care. And I say that again as someone who spent 28 years working in the hospital setting and then 12 plus years working at home. So I've experienced both worlds. And there is no question that even things that are labeled high risk don't necessarily need to be treated as such for labor and delivery. But the medical model has algorithms and that's all they know. And if you want to really get the experience that you deserve and make it precious for you and your partner and for your future children, then you have to do the work. And you have to trust that your body and nature knows what it's doing. And when it doesn't, it will tell you. Then you can have interventions if necessary. That's what I think. I think you find a doula, find a midwife, find an OB, talk to them all while you're pregnant, and just see which one gives you a better vibe.
Mm-hmm. Trust that intuition.
Yes, trust your intuition. Interview them. Again, like I said, do they look at you? Do they give you the time of day? Do they seem rushed? When you come back the second or third time, do they remember your name? Do they remember your partner's name? I mean, I always took 2 seconds before I walked in the room with somebody to make sure I knew their name, their partner's name, and their kids' names, if the kids were there. So that just to walk in and go, "Hi, Heidi. Hi, Johnny. How are you doing? How's mom doing?" That sort of thing. Just to make it seem warm and friendly,
Mm-hmm.
because that is an oxytocin releaser. It's not a cortisol releaser. You want dopamine, you want oxytocin, you want those good things. You want baby, you want to feel good, you want your partner to feel good, you want your baby to feel good, you want your children to feel good. And you can do that when you maintain your sovereignty, when you
Mm-hmm.
maintain control. When a doctor tells you something he thinks is necessary, ask them, "Can you explain to me why? Can you show me any data on that? I just had a 20-week ultrasound. It's perfectly fine, but now you want me to have a cardiac scan. Did they see anything on the 20-week? No, but it's part of our routine. Will they find anything? They didn't see it on a 20-week scan. Are they going to find anything that's going to change the management of my pregnancy for the rest of this time?" And the answer is going to be no. Well, you have a small ventricular septal defect or atrial septal defect. That's not going to change anything. It doesn't change the pregnancy. It doesn't change the labor. It doesn't change the delivery. It doesn't change anything. But they're going to want to do more testing. Ask them to explain why.
Mm-hmm.
And if they don't give you the time of day, make that a red flag and say, "Listen, this is not the practice for me. I can't get my questions answered."
Yeah.
And that's not necessarily the fault of the doctor. It's the fault of the system the doctor chooses to be in, which is where they give you 6 minutes or 7 minutes, and that's all they have.
Mm-hmm.
They have to do volume in order to meet their overhead. And that's how we'll change the system. And women take back the power, at least in the maternity world. I don't know about the rest of pediatrics and geriatric medicine and all that. They need a revamping there as well. The average geriatric person's on like 6 to 8 medications for the rest of their life.
Mm-hmm.
What a windfall for the pharmaceutical industry.
Mm-hmm.
Do we really need to be taking that? You're taking medicine, then you're taking medicine to treat the side effects of the medicine you're taking, and then you're treating medicine to treat the side effects of the second medicine you're taking.
Mm-hmm.
And nobody is trying to get down to the root cause. Why are you sick in the first place? What is going on? What can we maybe metabolically detoxify? What can we add to your supplements? What can we do to make you healthier in this way? Can we get you outside? Can we get you in the sun? Can we get you exercising? How do we do that? No, we're just going to put you on a statin, and we're going to put you on an antidepressant, and we'll give you a sleeping pill, and your thyroid's a little low, so we'll give you some thyroid medication. I could go on and on and on and on.
Yeah. But it's the paradigm shift that needs to change. And I love how birth is this focal point for that.
You take responsibility for you. Do not expect that the caregiver is going to have the same care for you and your partner.
Mm-hmm.
Right? They'll act like they care more about your baby than you do. They'll often use that terminology of using your baby against you. Like, you wouldn't want your baby to be injured, would you? You wouldn't want that. Right. That is coercion. That is sort of right off of the domestic abuser list of techniques, that the playlist. Yeah, that's exactly right.
Yeah.
You've got to take charge of your own health. This is not just for pregnant women too. This is for your children. This is for your partner. This is for men. They need to be careful about getting on a supplement or something that they're going to end up needing. They're supposedly going to need to take for the rest of their life. We weren't designed to do that. By the way, it's interesting side fact, maybe it's not true, but this is what I heard, is that the birth control pill was the first medicine ever designed that you were supposed to take continually.
Mm-hmm.
All other medicine was designed to take a short period of time, and then you're done.
Mm-hmm.
And since that time, obviously, they've come up with thyroid medication and other stuff. And maybe thyroid medication was first, I don't know. But it's very few medications. Now, most medications, what they want to do is get you on something that you have to take for the rest of your life.
Mm-hmm.
That's crazy.
Yeah.
Good business, good marketing, but it doesn't make good sense that you would have to do that for the rest of your life. We can try to fix the underlying problem. That's not to say, again, that medicine sometimes does miraculous things. And it does.
Mm-hmm.
But like anything else, all these things have mission creep. And they start to use it for things that are unnecessary, and to prescribe it for things. Like the next big disaster is going to be within 5 or 10 years from now from Ozempic.
Yep.
Going to see all kinds of problems. We've already seen them, but they're still marketing Ozempic and Wegovy as weight loss wonder drugs.
Mm-hmm.
you're doing something to your body that it isn't designed to do, and there are going to be downstream consequences to that.
Yeah.
And you can say, well, but I'm feeling better because I've lost the weight. Yeah, okay, fine. But what have you done to your metabolism, to your body, to your cells, to your
Hormones.
organs?
Yeah.
And then what happens when you stop it? If you haven't changed much else, you think it's not going to come right back on you again? I don't know how you think that.
Yeah. It's the
So,
short-sightedness of the medical system in general.
and the short-sightedness is motivated by monetary gain.
Yeah.
It's almost all stage one thinking is motivated by somebody's profiting from it. There's no profit in not taking Ozempic. There's no profit in not taking a medication that you're taking for life. You know, if you're on an antidepressant, you're probably supposed to take that for the rest of your life. I don't even need to get into the theories about serotonin reuptake and the problem with that theory as being the cause of depression, and the fact that the biggest drug ever, I think, that ever made money up until recently was Prozac, which was a serotonin reuptake inhibitor, and that may not even be the cause of depression, and it may cause more problems than it's worth, but yet they'll do it anyway. They put Vioxx out there, which caused heart attacks. Finally, they took that off the market, but they knew that it caused heart attacks before they put it out there. They put it out there anyway. Who are these people? And why do we trust them?
And why are we trusting our most sacred life events, like bringing life into this world, in the hands of these systems, right? That are working against us.
Which, just by their outcomes data, are not doing well.
Mm-hmm.
Again, it isn't about intention. It isn't about my doctor's a good guy. It isn't about I love my hospital. It isn't about any of that stuff. It's about what are the outcomes? How are we doing? And the medical model, which in the United States is about 98% of births, is not doing well. And the bad outcomes in our country are not because 1 to 2% of women are choosing to birth at home. And yet you think home birth is the villain because there's so much energy spent by the industrial lobby like ACOG against home birth, when they should be cleaning their own house first. Clean your own room before you tell me how to clean mine.
Mm-hmm.
They're very authoritative. They think that their way of doing things is the right way of doing things, and they're not listening to anybody else because, again, it's too painful for them to actually realize that what they're doing is not working.
Yeah.
Right.
And that's why I love your message, just for us to trust our intuition. It is so much of the antidote to what is happening.
Get back to critical thinking and logical thinking. When I was in middle school, I took logic. I don't think they teach logic anymore.
No.
Right. I took civics class. They don't teach those things anymore. They don't teach critical thinking. Matter of fact, they don't really want you critical thinking. They want you mesmerized by your device, scrolling all day long, buying stuff.
Mm-hmm.
And subliminally, if that's a word, subliminally.
Yeah.
Yeah. Say that fast many times. They're influencing you to buy their products or to trust their judgment. ACOG puts out memes all the time about stuff that, if it's not wrong, overtly wrong, it is certainly not the only opinion of most obstetricians or the only option. And yet it's put out there so authoritatively that you would believe that all obstetricians must agree if ACOG says it. I would tell you that that's not true. The American Medical Association, one of the biggest frauds out there, they make almost all their money from selling the coding. They have the monopoly on billing coding, and so they sell every year the software and all that other stuff. Only about 14% of physicians in the United States belong to the AMA, and most of them are in academia. They do not represent the rank and file physician, yet when they speak, the news media just bow down and assume that they're speaking for physicians.
Mm.
I would ask the news media and stuff to stop kowtowing to these people. They have led us astray.
Mm-hmm.
So let's stop. Let's just look deeper for common sense. As people always say, don't take my word for it. Go out and do your homework and figure it out yourself. And see if what I'm saying makes any sense to you.
Mm.
That's the message I would give is, if this sort of resonates with you in some way, then do your homework and see. Because I'm not practicing anymore. I'm not making a fortune on clicks. I'm doing this and I'm teaching Breech and Twins. Obviously, I'd get paid something, but I'm teaching it because I truly believe that this skill is valuable. I think of all the families whose lives have been changed by the women who've had a breech birth because of courses that RICSA and Breech Without Borders or I with Reteach Breech have taught. And I get emails all the time thanking stories. Now, occasionally there's a tragic one that happens, and yes, that happens. But for the most part, these families' lives will never be the same. They won't have to deal with the problems of a VBAC issue in the second pregnancy or the third pregnancy. And the breech birth was just a butter birth for them. And they're so grateful that they found somebody to do it. And with this, the people that are trying to regulate this away are doing so simply because they're being told by people who are afraid of it that it's dangerous. And no, I think they are dangerous. I think what they are saying is dangerous. That a woman has the right to decide to accept or refuse treatment. And we are supposed to acknowledge that and support that. That's our ethical obligation, is to inform women, give our subjective opinion about something, but if a woman chooses to do something different, then we should support that. And support can look in many ways. It could be, I'll help you even though I don't think it's the right choice for you. Or it could be, I think a vaginal breech birth is not what I can offer you, but I support you, so let's find you a practitioner somewhere in town who will help you. That would be support. But to say to them, I'm sorry, but I can't help you because I think it's too dangerous and your baby's head will get stuck and your cord will prolapse and your baby will die, that is unethical, and yet that goes on far too often. So what is your intuition about where we're headed?
So I believe a lot of these systems are becoming so overtly ridiculous and very difficult to navigate. Like, we're entering a phase where everything is just going to be so emphasized and extreme and amplified. The amount of fear, the amount of war, the amount of rage, the amount of confusion, the inability to decipher what's true and what's not true with AI. It is almost the breeding ground for us to connect to our intuition, because that's going to be the only way that you can navigate what's happening right now. And women are going to remember that not only do we have the ability to bring life into this world, we also have the ability to birth what we desire for ourselves and for the next generation. We are going to remember that we have the ability to birth true peace. And that comes only after seeing the destructive reality of false peace, I will say. And it's from our wombs. We have the ability to create. That is what we do. We are creators. And that is where everything's going.
I hope you're right. I do think that things are getting so chaotic that people are starting to become more self-reliant. I live with a very skewed community because of what we do, you and I. But I know more and more people are going organic. More and more people are finding alternative paths to do things. They're maybe joining co-ops instead of buying insurance because they've had it with insurance companies. They're grouping together to do things more like they did in the olden days, like the Amish still do today. They help each other out. They're making communities where they're like-minded people. And obviously you can't get away from all tech and all those sorts of things, but they're finding that the world is too complicated. You can't reach a human being anymore. And you have a problem with your credit card or something like that, and it's all automated, and you say, I want to speak to a representative, and it says, oh, I'm sorry, I don't understand that prompt.
Yes.
It's like, so you're looking for alternatives. You're looking for other ways of doing something with like-minded people, and you're making sense of community. And your community may have changed because your neighbors may have been people that hated you because you were out playing in the backyard during COVID. And so your neighbors are no longer the people that you are in sync with anymore. You might have been in sync with families for a different reason or a different logistics of how you got together. Yeah, I think it has to change because the alternative to me is really unthinkable that we continue down this path because then we're heading toward our own extinction.
Yeah.
I mean, all you have to do is look at fertility rates and look at what's that?
It's what it takes. We need to almost be going down so extreme for the phoenix to rise from the ashes.
I have a t-shirt that was before Dan Bongino became deputy director of the FBI. He had a podcast. I used to listen to him all the time. And he had a t-shirt that says, is it bad enough yet? Because until it's bad enough, things don't change.
Yeah.
Like,
And we're
look
going
at
to be
California.
poor.
They have these fires, they have these mudslides, they'd have infrastructure falling apart, and they keep voting for the same people.
Mm-hmm.
They voted Adam Schiff to be their senator. I have no idea what they're thinking. Is their thinking even going on? Because you keep voting for the same people that make the mess that you're in.
Mm.
You have only yourselves to blame.
Mm-hmm.
You do, because that's the definition of insanity.
Yeah. And
Now,
even
government,
continuing to externalize your power to a politician
yeah,
is an issue in the first place. And so there is this awakening of the return of the onus of control, or the return to power in ourselves and in our family units and in our community, and realizing, wait a second, I'm a human being too. I get to make some decisions. This is my life. This is my body. This is my baby. This is my family. This is my community. This is my home.
it's going to have to be bad enough, because right now they've
Yeah.
created a system of dependence. People don't go out of their house anymore. They order everything on Amazon. They order Instacart. They don't interact anymore. And they become dependent on certain things. I think because we're not teaching the basic skills that society needs, the auto mechanics, the plumbers, the welders, those sorts of things, that most people have no idea how to fix a leaky pipe anymore. My dad would just do it. He knew how to do it.
Mm-hmm.
But we don't learn those things. We're becoming so dependent, and that's exactly what the big corporations and the big government issues, they want us to be. Because when you're dependent on them, then you're pliable and you can be manipulated.
Yeah.
And ultimately, that's where it comes from. Is there some big cabal that's actually sitting there making this plan? No, I think this is just the nature of mankind and societies, is that they tend to deteriorate to the point where they become chaotic. There's anarchy, the government falls, then there's socialism, then there's communism, then there's more anarchy, and then somebody rises up and starts the whole thing over again. And just look at the empires that have come and gone. The Roman Empire, the British Empire, right? They all come
Yeah.
and go. Why did they? At one point, British controlled what? I don't know. I can't remember, some ridiculous amount of the world's wealth.
Mm-hmm.
And then it fell apart, right? And as it will.
What if this time it's different? What if this time, because we understand birth,
Right.
because we understand our power, we
Let's hope that that's the
understand.
case. Let's hope
Yeah.
that's the case. And it's not like the current modern day socialist who says it's socialism didn't work in the past because they did it wrong, and we're going to do it right. I've heard that many times. So
Mhm.
you can't have the same people that got us here being involved in the solutions to get us out of here.
Yeah.
They don't know anything.
I agree. You know much more than I do from your personal experience, but that's what I'm seeing across the board is a lot of fear and doubt instilled. Uh, yeah. And it just doesn't result in any good outcomes for either
Yeah.
the
So
mom.
let's make it better. Everybody listening, let's make it better. Let's start by taking ownership over our sovereignty and deciding that, okay, I don't want my kids vaccinated. I'm going to have to homeschool, or I'm going to have to move to another state because the state I'm living in won't let me send my kids to public school that my tax dollars are going for without being vaccinated. I think I mentioned earlier the American Academy of Pediatrics is committing suicide by making a statement saying that no exemption other than a true medical exemption should apply. I don't think they've got their ear to the ground right now and hearing that people are reluctant about it. And I think that they're way overzealous of promoting something like that.
Yeah.
It is tough for me to say this, but I will say it once again, that the medical system has failed when it comes to maternity care for most women. For some women, they do great work, but they apply those principles to all women. And in doing so, they have created outcomes that are not beneficial to us, our children, and our future generations. And it's time for a change. I'll just say that.
Truly, truly, truly. Powerful message. I so appreciate your work. Just so much gratitude for the work that you're doing out in the world. It is truly mission driven and purpose driven, and will have ripple effects onto the next generation and generations to come. So thank you for, I think, just humanity. This is important work. Yes, truly. I know you mentioned your podcast. It's called Birthing Instincts. We'll put the link in the show notes. And what is the best way for people to connect with you if they want to reach out, if they want to just send you a story, if they want to message with you, or just learn more about what you're doing? What's the best way for them to do that?
Yeah, unfortunately, time caught up with me, and so I stopped doing active primary clinical practice. I had been on call for almost 40 years, so now I just do my teaching and I do online meetings with people who have questions or practitioners. I have an annual all access membership for midwives or doulas who want to reach out at any time for a non-emergent question. They can find all this information at my website, which is www.birthinginstincts.com. And our podcast is the Birthing Instincts Podcast. Instagram, I'm at Birthing Instincts. And then they can go to www.birthinginstinctspodcast.com, where they can get connected to our Patreon and other things to find added content. We have a community of over 1,000 people that are in our community, and there's different tiers. There's a free tier, and then there's all kinds of different tiers, and you get different levels of information and time with us and one-on-one meetings with us and stuff. So that's how you reach me. My papers that I've written are open access, so you could search them on internet, or you could go to my website, and under the About Dr. Stu page, there's a click, and you can click on any of the papers that I've written, and you can read them. And then my reteaching Breech seminars, that's one of the things I really have a passion for. And I do about maybe 10 to 12 seminars a year, wherever I get invited to do them. And they're 2-day seminars with hands-on training in breech and twin skills, including breech extraction, internal pedalic version, and the cardinal movements of breech. And then a lot of just my talking about breech and twins and other wisdoms I share over a 2-day period of time. And they've been very well received, and it makes me very happy that people go on and take that skill and then go out in the community. And even though you can't take a course and then become a breech expert, you can have confidence to help a woman who may have a surprise breech at the last minute. And if you want to start doing breeches, you can start to develop that, and you can have a skilled practitioner come with the first few that you do. And so that's the only way to train, is to do it. You can watch all the videos you want in the world. It's like flight simulator. You can do flight simulator till you're blue in the face, but until you're solo for the first time and have to land the plane yourself and do that, you're not a pilot. You have to do certain things. The same thing here. You have to do it. And where are the people going to get these skills if they don't take the courses that we're offering? Because they're not getting it in the training programs anymore, except in very few locales in the world. And it is a skill that deserves to be universal. Even the Royal College of OBGYN has said that every hospital that does obstetrics should have somebody on staff available in the case of a surprise breech delivery. And yet, that was written in 2017, so what's that, 8 years ago? Nothing's been done, right? If they had written something that had made the hospital a profit, they would have done it right away.
Yes.
That's my cynical side.
Yes.
So I don't want to end on a cynical note, but you can't get away from it. So that's how people can reach out to me. I tend to respond to every single message I get. I don't know how much longer I can do that, because it really is starting to take up a lot of time during the day. But I try to, because my goal in life is to try to make the individual experience of every woman or midwife who contacts me a better experience. Right. And there's no perfect solution. There's no perfectly safe place to be. So do your research to figure out what feels best for you, and trust your body, trust your intuition.
Yes. And I would add, trust your instincts.
That's the name.
Yes.
Right.
Thank you again so much. I just feel grateful that this is going to permeate into the waves and be transmitted out into the field and hopefully be received by those who need to hear it. So thank you again, Dr. Stu.
Thank you for having me on, and congratulations on the podcast. And I look forward to its release. Thanks, Cindy.
Thank you.
Thank you so much for joining us on today's episode of Rewire for Birth. We hope you found our discussion inspiring and empowering. If you enjoyed the episode, we would greatly appreciate it if you could leave us a review on your favorite podcast platform. Your reviews help us reach more listeners and spread the message of holistic, empowered birth experiences. Feel free to mention what you loved about today's episode and how it helped you feel more prepared and confident about your birthing journey. Your feedback not only encourages us, but it helps other moms-to-be find our podcast and join this incredible community. Together, we can make a positive change in the world of birth. Until next time, stay empowered and keep rewiring for birth.